Welcome everyone to yet another edition of Three Plastic Surgeons and a fourth. As always, I am joined by Dr. Sal Pacella, who is at San Diego Plastic Surgeon, Dr. Sam Rhee, who is at Bergen Cosmetic, and Dr. Lawrence Tong, who's at Yorkville Plastic Surgery. I'm Sam Jejurikar, who's at Sam Jejurikar. Welcome, gentlemen. Today, we are going to talk about a very, very exciting topic, which is common myths after facelift surgery. We've done this previously after other procedures, and we've gotten really good feedback, so we thought we would continue the series. Before we dive into the meat of it, Dr. Tong, will you read our disclaimer?
Yes, sir. This show is not a substitute for professional medical advice, diagnosis, or treatment. This show is for information purposes only. Treatment and results may vary upon the circumstances, situation, and medical judgment after appropriate discussion. Always seek the advice of your surgeon or other qualified health provider with any questions you may have regarding medical care. Never disregard professional medical advice or delay seeking advice because of something on this show.
Okay, so I think before we get into what are myths of facelift surgery, someone want to tell our audience what is a facelift in very general terms and what makes it different than non-surgical procedures?
The dude in the yes, I'll go.
The dude with that.
I think before we get into that, we first have to explain our garb here. So for those of the audience that are not football fans, we had an amazing win against Ohio State, even though we had barely a winning record. We beat our arch rival. So here's to the victors.
Go blue. Go blue.
Go blue.
All right.
7-5 season, but still a success when you beat Ohio State.
That's right.
That's right. All right. So facelift. So we got to understand how the face ages. I think that's a very important concept, right? So not only does the face descend, all the soft tissue loosens up and drops, but we tend to lose a lot of volume in our face. So meaning fat. And, I tell my patients, it's one of the cruel tricks of nature. The more in shape you are, as you get older, the worse your face looks, because if you ever look at somebody who's portly, their face looks actually very youthful because they got some chunkiness to it. But if you have a fit 65-year-old that runs marathons, their face is oftentimes going to look very gaunt, particularly in the center of the face. So a facelift is really designed to surgically treat both of those issues simultaneously. Most of the time, the lifting component, but oftentimes frequently the volume component. Whereas non-surgical treatments are really designed to add little specific areas of volume or little specific areas of filling only.
Well said.
It's a great explanation. And so, we'll see patients that are coming in for these procedures and they've done a lot of research before they've come in. What are things that you've heard from your patients that you feel like you have to explain to them isn't really true? Dr. Rhee, why don't you start? Yeah, why don't you start?
I think the first thing is a lot of people, when you talk about facelifts, they're worried that they're going to look like Mickey Rourke or, these crazy celebs who have really awful plastic surgery. They think facelifts make you look weird or terrible or unnatural.
Now, I want to go to Dr. Pacella, because Dr. Pacella told us a line on a previous podcast, which I've subsequently adopted. How long do you tell your patients that they look bad for after their surgery?
6 months.
Yeah. But I think you said something about them eating at their third favorite restaurant.
Oh, yeah.
Yeah.
Oh, yeah. I got that from my good friend Lou Bucky in Pennsylvania. He uses that line, and I think it's very unique. I'd say after about 3 weeks, you can go to your third favorite restaurant. So,
yeah.
So, one thing I think is a common myth that patients always sort of say when they come in for facial rejuvenation. It's like you got somebody who's got a real long face, very thick neck with a ton of skin. And they say, I was doing a little research on Google, but a full facelift sounds like a real problem. It sounds really intense. I just want a mini lift. I just want the mini lift, right? So it's like, it's sort of like wishful thinking, right? Like everybody defines the mini lift in a different ways. Some's a small incision, Some is just a big incision that's just the skin. Others describe a mini lift. That's just a word they use for a full facelift, right? And so just to make it sound less intensive to patients. So I think, the key in my practice is really making the facelift bespoke or tailored to each particular patient, regardless of what you call it.
Okay. Dr. Tong, what about a myth that you've heard from patients?
Well, I just want to comment on what Dr. Pacella just said. When patients do this, a lot of times they think that the neck is going to be improved as well, because a lot of time, and
100%.
you see this all the time, when you use your hand to do something, it's not the same as doing the actual surgery. So, you have to take some time.
That's what she said? I'm sorry. What's that?
Oh, cancel. Timeout. Final cut.
Sorry.
Sorry. When I said that, I was waiting. I didn't know who it was going to be. I thought it was going to be Pacella.
Exactly.
But thank you for going there, Dr. Jejurikar. All right. I don't even know where I was at. Anyways, you have to take some time to explain, what the facelift does. And I think it's important to also note that there are different names for procedures that might be the same. So in general, I think a generally accepted definition of facelift is something that's going to improve the neck, which is to tighten the neck, remove some fat, get rid of loose skin, and improve the face. And when I say face, it's jawline, maybe some of the marionette lines, nasolabial folds, and cheeks. Importantly, it doesn't do anything to your eyes, doesn't do anything to your brow or your forehead. So one thing that patients have a myth about is that facelift is going to, fix everything. And it's mostly just sort of the lower, I would say, 2/3 of the face.
To expand on that, Larry, a lot of times I have patients come in. Another myth I would say is, they have these kind of long lips and really intense vertical lines, tremendous amount of sun damage right in the perioral region. And they say, oh, look at how much that gets better when we do this, right? Well, a facelift, common myth, it does not improve the center of the face right here whatsoever. That is a different set of procedures: a lip lift, fat augmentation, skin resurfacing, etc.
Yeah.
That's right.
And when patients mention that to me, I say, well, if we're going to be pulling that hard to get the wrinkles out of your lip, your mouth is going to get distorted. Then instantly they understand that it's not viable.
Yeah, I've in my practice started just calling it a lower face and neck lift just to avoid the confusion. But a lower face and neck lift equals a facelift. I think that is a great point that Dr. Tong and Chella brought up. I think another myth that I have seen is that facelifts are only for women. I think, men come in and they'll think, what can I do? I don't want to get a facelift because I'm going to look like a woman. But, there's nuances to how we do facelifts in men versus women. We design the incisions differently so that we're not pulling beard hair onto their ears. We might tighten the deep soft tissue in a different sort of way so that we don't make them look as feminine by adding too much volume to the middle of the face. We might inject fat differently so that, again, we don't make them look feminine. The facelifts and neck lifts are very common procedures for men, not just women.
Yep, agreed.
That's right. Yeah.
One thing that I wanted to point out, I think Dr. Pacella said, patients come in and they think they're going to look like crazy or too tight. I think those are bad examples of cosmetic surgery. And I think oftentimes it's patients who've had multiple procedures. I think that's important to understand, is that there's only so much tissue on your face. And if you have multiple facelifts, like I'm talking 3 facelifts or more, or even just lots of cosmetic surgery on top of that, other things, you can start getting distortion and things looking unnatural. So it's important for patients to understand that you can still get a very natural result, and that what you might see on TV or media are usually bad examples. And there's a lot of well done surgery everywhere, and you don't notice those. And, that's the kind of results that we try to get. Somebody who looks natural, looks refreshed, looks younger, but doesn't look like they've had surgery.
What about any other myths that you guys may have encountered?
I think one of the things I see is patients will come in and they'll say, my spouse or my family have told me not to get it done because I'm just being vain. I look fine. I don't, they're telling me I look fine. They're telling me it's just purely for cosmetic reasons. You're good enough the way you are. And why take that risk and do something that could make you worse? And I think for a lot of patients, they feel guilty a little bit that they're actually thinking about doing something for their face. And for a lot of patients, when I see them afterwards, uh, they had to fight the people around them sort of to get the procedure done, to convince them. And when it is done, their family realizes what a net benefit, not physically, but mentally it is for a patient. When their outside image does not match what their inside image is of themselves, it changes what they do every day. It changes what they wear. It changes what activities they engage in, and it changes pretty much everything that they do on a daily basis. And once they develop that self-confidence because their facial appearance now better matches what they think of themselves, and these are usually not people who are looking for insane or crazy results. They're looking just to look like what they did uh, in a more natural way. They're not looking to change or alter who they are. And once they get that appearance that matches their goal, it's astonishing actually how their family then realize just how much of a better quality of life that they have by doing that.
Here's another myth just to sort of dovetail on that is facelifts are only for old people. They're only for the elderly. Okay. And I think what we're seeing really is, I have patients come in their 40s and 50s now for facial rejuvenation. And there is a lot to be said for doing a procedure earlier. We can make that procedure a lot more simplistic. There's less surface area that needs to oftentimes be maintained or elevated. You get a net benefit throughout your lifetime of an earlier procedure, and a lot of times you're healthier at that age than you would be at 80. I mean, it's hard to make an 80-year-old look like a 40-year-old, right? But you could make a 50-year-old look like a 40-year-old, right?
Yeah.
Right.
And just to build on that, we have spent a lot of time in other podcasts talking about massive weight loss and talking about Ozempic and medications like that. I'll see patients in their 30s at this point who have lost large amounts of weight, have a lot of laxity, not just of the skin, but also of the deeper soft tissue of their face, who need a facelift to get the results that they want so they actually match their age. And I think that leads into another myth, which is that the results don't really last that long. People assume that if they get a facelift that, they're going to look the way that they did before the facelift a couple of years later. And what I would say is you do a facelift, you set the clock back a certain amount of time. Maybe it's 7 years, maybe it's 10 years, maybe it's 15 years, depending on the degree of severity of the problem that you're dealing with. But then the clock starts all over again. But when you get to that point 10 years later, you look like you would have previous to the facelift. But the results definitely last a long time.
One caveat with that, Sam, I think most of us here on the podcast are treating the deeper tissue, either doing a smastectomy, smastplication, or deep plane facelift. I think that statement is very true if you deal with the SMAS component or the deeper subtissue. But I would say, in just simple subcutaneous facelifts, the sort of cheap facelift that you see, the lunchtime lift, I think those results don't last very long at all.
I think you're right, which is another myth that all facelifts are the same. I think all of us do facelifts in a way that we were trained, which is to definitely address the foundation, the deeper soft tissue, and that's how you see long results. But you're right. Procedures that are not done the same way definitely do not last.
I think another potential benefit of doing surgery earlier is that the patient gets to enjoy it earlier, gets the benefit of it earlier. So, if you wait till you're 70 years old, yeah, you look good at 70, but maybe you could have started looking good at 60, 10 years earlier. So, the other benefit is you might not have such a drastic change. So a lot of patients come in, they don't want to look so different. They want to look like themselves. But if you have very saggy skin because you've waited to have your facelift surgery at a later age, you're going to look different because your amount of improvement is going to be much more significant. So there's another benefit. It's more like I talk to my patients, it's sort of like more of a maintenance thing than it's sort of a makeover kind of philosophy.
How about this, gents? Something we see commonly in Southern California, and I'm sure you guys see it where you're at. Facelifts help with sun damaged skin, leathery skin, fine wrinkles, etc.
No,
don't do anything for it.
Yeah.
That's right.
So yeah, so what Sal is talking about is that patients think that the facelift is going to somehow improve what I would call sort of the texture and the quality of the skin. Facelifts serve to reduce sagging and improve the volume, but the surface is not really going to change that much. That's going to be things like lasers, skin care, better sun avoidance, cessation of smoking, things like that.
I mean, what I will do is for a lot of my facelift patients, I'll do a TCA peel at the same time because they're under anyway. And I'll do a 20 or 25% TCA peel. And that doesn't feel great when you're awake. I mean, you can tolerate it, but it's almost a freebie in terms of recovery from a TCA peel, which does help because a lot of patients who do need facelift surgery also can benefit from a chem peel at the same time. I know maybe some of you guys do laser or some other skin type treatments at the same skin resurfacing treatments at the same time as well.
I mean, I think it all comes down to the fact that people are getting facelifts because they want to do things to reverse the aging process. Sun damage is also another sign of the aging process. And so when we were doing facelifts during our residency at Michigan, I remember whenever Hack Newman was doing a facelift, peel or laser or a four-lid brow. We called it a blue plate special where
Yes.
like whatever. And so I think we probably do these combination procedures where we're doing a lip lift and a TCA peel and four-lid blef. I mean, we do all these other things at the same time to reverse the aging process, but ultimately they're all separate from the facelift itself.
I think another thing I'll see are patients that have gotten so much non-surgical treatment in an effort to avoid doing a facelift. So they'll get so much filler, they'll get so much other non-invasive type treatment. And a lot of times that is completely the wrong approach to address. I mean, a facelift addresses what we just talked about. A lot of the non-invasives, a lot of the filler type stuff it almost looks weird when you see these patients where they've tried to do, they've gone through all sorts of contortions to try to actually avoid what I think would have been the simplest and most direct procedure for them.
Yeah, the most common stigmata I see in what you describe is injection in the pre-zygomatic space right here. This is oftentimes done by injectors where they put a ton of filler kind of in this region right here, not really understanding the anatomic box or constraint right here. This area, the pre-zygomatic space, has a definitive structure to it. And oftentimes you see indentations around that area, around that box. And a common maneuver is placing filler in that region, but they get that filler inside that ligamentous box, and it just ends up being a big, massive, puffy thing here that just looks terrible. So it's common thing we see.
Another concern that patients, when they come in, is they're concerned about the scars, and they're concerned they're going to be visible. So for our audience, typically a facelift involves putting a scar that starts behind the ear at the lobe, in the groove where the ear meets the head. And once it comes up to about the widest part of the ear, it jets back and then either along the hairline or into the hair. That incision allows us to lift up the neck skin and work on the neck. And then the other part of the facelift incision comes in front. And when I say in front, it comes in between the crease between the earlobe and the cheek. And then once it gets to the opening of the ear, it's going to go sort of behind that little moon-shaped piece of cartilage, the tragus. And then once it gets to the top of that, continue up. And then once it gets to the hair, it can either go into the hair or around the sideburn. In my experience, and I'm sure in your guys' all experience, these scars heal very, very well. Particularly in women, they're in the beginning, they're much easier to hide, even if the scar is a little bit painful, more visible, because women have longer sideburns, they have longer hair at the back, they have access to makeup easier than a male patient. And so, in my experience, the scars generally aren't a complaint when a patient has had enough time to heal after a facelift. They're, especially in light skin or Caucasian patients, those scars are very, very difficult to see. Even I would say within several weeks of the surgery, unless somebody knows that they've had it and they're sort of trying to.
And I totally agree with you, Larry. But again, I think it comes down to how the incision is designed and the surgeon doing it. You will see that when you're getting one of these lunchtime lifts that Dr. Pacella was talking about earlier, where they're not manipulating the deeper soft tissue, a lot of times surgeons will overly tighten the skin. And you'll see, particularly behind the ear, where the skin may look like the incision may be really wide or maybe really thick, and that can be a telltale sign of a bad facelift. I think if you set the skin with appropriate degrees of tension and you set the foundation by manipulating the SMAS layer, what you say is 100% true. The scars are very forgiving.
Yeah, I've had women who were worried that they couldn't put their hair up, and afterwards, and they could pretty much wear their hair any way they want. I think the only challenge would be if they went completely bald. That would be a little bit of a challenge. But other than that, I tell women there's no reason why we don't expect you to wear your hair whatever way you like afterwards.
Yep. I think another myth that we haven't touched on involves the recovery process. I think particularly patients that have had previous cosmetic surgery, they think that a facelift is going to be incredibly painful, that it's going to be painful to the degree of a tummy tuck or something like that. And typically, in my experience, patients don't look great the first few weeks, 2 or 3 weeks. I tell them there's some buyer's remorse, but they're not really in that much pain. They complain of a little bit of burning of their skin. That usually is better within a couple of days. Things feel a little bit tight, but I just don't find that they have that much pain.
I agree.
Yeah, it's
Yeah,
mostly a feeling of sort of tightness. And then I always tell patients that the skin is going to feel numb for several months, but it always all comes back.
Yeah, I think you're right. I think getting through that first 2 or 3 week period where everything's super puffy, swollen, maybe they're, like you said, they're like wondering what did they get themselves into. And then once that phase starts to pass, like, and you start to see what the results are and they start coming into focus, that's when the recovery process accelerates pretty quickly. And it always blows me away to see someone at, say, a 3-week post or 2-week post and then like a 7 or 8-week post. Like it's a pretty remarkable recovery at that stage.
Well, any other myths you guys feel like we haven't touched upon?
How about this myth? Facelifts are inexpensive.
Yeah, I have definitely. I'm sure you guys encounter this too, where you'll have online inquiries and people are trying to kind of figure out
Price
how much
shop.
things cost, and they'll ask what a facelift is, and you give them a range, and they're outraged at the number that they get back.
It's
What's
Yeah,
your
I mean,
line
it's,
about cars and houses? Again, you have some great lines for this.
yeah, I say many years ago I used to say, well, it's less expensive than a Prius, but it will last you longer. Now I sort of say it's less expensive than a Tesla since inflation came about. You know, you think about it. It's like you buy an automobile and you finance it. What's the life expectancy of the average car? 5, 6, 7 years that you're going to hang on to it, right? You're going to get a facelift. It's going to last you 10, 15, 20 years, right? And it's less of a cost. So,
yeah. And to build on that, there are financing options for patients as well, where they can pay for it over many years to make it less affordable. And it's not that the surgeons are trying to
more affordable.
to make it more affordable. Thank you. It's not that surgeons are trying to gouge the patients when it comes to pricing either. It is a very time-consuming, labor-intensive procedure that generally takes us all day, and there's so much post-operative management involved as well that there's a lot of time that's spent in taking care of these patients.
I think that's exactly right. You're paying for the expertise of the surgeon, and they are shepherding you the whole way through the process and through the results. And that is very time consuming. And when we take on facelift patients, we're all in for the whole thing. And it's literally people's face. So I can't imagine another procedure where someone would not want to cheap out on it than something so dramatic as a facelift.
Agreed. Yeah, from a technical standpoint, doing the surgery itself, it's much different than, doing liposuction or something.
Yeah. I think another myth is that the recovery is quick. We've sort of alluded to that during this entire time. But I think, if you're getting your information from the internet and all you're seeing are before and after pictures, and you're not really paying attention to how far post-op these patients are, people sometimes think that they're going to be back to their normal life within a couple of weeks. It can be, if you don't really explain to patients that it's a long recovery and there's going to be a several week to month period where they're not going to look like themselves. Oh, I like that. They're not going to look like themselves. It can be hard.
I want to take Pacella to my third favorite restaurant. That's where I want to take it.
Yeah.
Well, hey, listen, I haven't eaten at Chili's in many years. Okay.
That's my first favorite restaurant.
Any other myths that you guys can think of? Well, I think that seeing other or not, we do need to shift to one other topic real quick. And that is a bill that's been proposed by Republican State Senator Josh Williams in the state of Ohio. It's called the Ohio Sportsmanship Act. Are you guys familiar with this?
Yes, I've heard about this. It's illegal to plant a flag.
They want to make it after the recent trouncing of the Buckeyes by the Michigan Wolverines and the attempt of the Michigan players to plant the flag in the center of Ohio Stadium. They now want to make it a felony offense to plant the flag in Ohio Stadium, which is ironic because this practice actually started years ago when Baker Mayfield did it at Ohio Stadium, and then we did it 2 years ago. So just wondering if you guys had any comments on this proposed legislation from the esteemed legislator from the state of Ohio.
I think they expect that they're going to keep losing and that people are going to keep trying to plant flags. I think that's what they're afraid of.
Yeah.
Yeah. To quote,
well, you know what they say? If you can't
go ahead, sorry.
If you can't beat them, make them beating you a felony offense.
Or, as from the mouth of babes, my middle schooler would say, dude, that's so Ohio.
Oh, exactly. I love that. All right, gentlemen. Well, as always, it was a pleasure. Go Blue.
Go Blue.